Welcome back to the Mastering Your Fertility podcast. This show is all about reclaiming health, enhancing fertility, and preparing for pregnancy. We're Kristin Cornett and Dr. Haley Nye, your hosts and the creators of the online fertility platform, Tiny Feet. All right, everybody, thanks so much for tuning in with us today. For those of you that are new to the podcast, we're a nutritionist and naturopathic doctor team helping educate and empower couples on their fertility journeys. We both have private practices in Portland, Oregon, where we live, and we own and manage an online practice together through Tiny Feet. We take a unique functional medicine approach to fertility and help couples truly get to the root cause of their health and fertility struggles so that they can conceive successfully and have healthy babies. Our services include functional lab testing and one-on-one consults, as well as our online fertility assessment and online courses. You can learn more about us and what we do on our website at tinyfeet.co. If you've been enjoying the podcast for a while, we'd love to ask you to please share your experience with us through a rating or review on iTunes. It absolutely makes our day to hear from you guys, and it really helps us get the word out to more couples who can benefit from the preconception and fertility education that we share here on the podcast. Thank you guys so much in advance for your support. You're listening to episode 43, where we're going to be interviewing functional nutrition expert and autoimmune paleo coach, Brandy Cummings, about how she's using the autoimmune protocol, or AIP, in her practice to help women get pregnant and have healthy babies. Now, we've talked about autoimmunity several times on the podcast, and we've touched on AIP periodically as well. This is actually the dietary approach that I've followed pretty consistently over the past few years to help manage my autoimmune and inflammatory symptoms. And we do use this protocol frequently with clients who are showing signs of immune dysfunction. I have actually taken the certified AIP coach training myself, and I am excited to have another coach here on the podcast to talk about her experience and success using this awesome protocol in clinical practice. So in this episode, you're going to learn the specific dietary guidelines that make up AIP and the reasoning behind them, the often ignored and yet equally important non-food aspects of autoimmune healing, and how AIP can specifically benefit fertility even if you don't have a diagnosed autoimmune condition. We also touch on some other topics like the difficulty in getting autoimmune issues taken seriously and accurately diagnosed, why it's so important to seek out support when taking on a protocol like AIP, and also whether AIP can be successfully used during pregnancy. So if you're curious about whether you may be suffering from some inflammatory symptoms and whether an elimination diet like AIP might benefit you, we highly recommend downloading our free quiz called Are You Healthy Enough to Get Pregnant? This quiz asks about symptoms in 5 different health categories that are all critical to immune system function, and it also gives you some practical recommendations to start addressing your symptoms. You can find the link to download your quiz through the link in the podcast episode description. Downloading the quiz will also earn you priority notification for our brand new online course that's coming out in September, so in just about a month, called Fertile in 5 Masterclass. The course is very comprehensive. It's a 5-step program to help you prepare for a successful conception and a healthy pregnancy, and it includes in-depth guidance on diet, lifestyle, supplements, environmental exposures, and working with your doctor to receive optimal preconception care. So stay tuned for more details, as well as the official launch date, which we'll be announcing on the podcast and via email within the next few weeks. All right, so we're going to get started on this week's episode. As a side note, as you guys can probably tell, I'm going to be doing the interview solo this week. Dr. Haley just went through her explant surgery to remove her breast implants, which she talked about in depth in episode 40 of the podcast. So if you missed her story, you can learn more about what she's been going through there. But I am happy to report that her surgery went very well and she's recovering nicely. So be sure to send her some love on social media this week. I know that she would love to hear from you guys and soak up some words of encouragement as she continues on her healing journey. All right, so without further ado, I'm going to introduce our guest this week. Brandy Cummings is a certified nutrition consultant and certified autoimmune paleo coach, and she also has a master's in human nutrition and functional medicine from the University of Western States. She came into the holistic health and nutrition world through her own health journey, and she turned to food and holistic health care when conventional medicine just didn't help her. She specializes in working with women trying to conceive, pregnancy, postpartum, autoimmunity, gut health, and hormone balancing. Brandy believes health is multifactorial and that all areas need to be addressed to really uncover the root cause of illness and achieve optimal wellness. This includes diet, lifestyle, genetics, gut health, environmental toxins, and past trauma. You can find Brandy on her website at thrivingvitalityllc.com and on Facebook at Thriving Vitality LLC. We hope you enjoy the interview. All right, welcome, Brandy. Thank you so much for joining us today on the Mastering Your Fertility podcast. We're so excited to have you.
Thank you so much. I'm excited to be here.
Yeah, I'm excited to talk a little bit more about the topic of AIP with our listeners. We've brought this up before on the podcast, but we haven't really talked in depth about it and why it's such a favorite of ours especially for like immune system issues around fertility. So I'm excited to chat more with you about that. But why don't we get started with you telling us a little bit more about your background and what actually got you started in the nutrition field?
Sure. Yeah. Well, I think my journey to the nutrition world, particularly the, more holistic, functional nutrition world, is very similar to a lot of people. I had my own health journey that I went through, and it really started when I was a teenager, just not really feeling good, and just the resources that were available to try to figure things out were just not there. And, a little bit, when I was a little bit older, I had some issues with some pretty severe mold illness, and I've struggled with infertility. So I just going through that on my own and not having the support and resources that I needed, led me to this field. So I got busy and I went to school, and I started at my own practice so that I can just be helping other people and hopefully make their journeys easier than mine was. And then not just my journey, but food just makes me so happy. I just love all things food. I love talking about food. I love making food. I love shopping for food, eating food, farmers markets, learning about food in different cultures. All of that is just so very interesting to me. And then the science behind it, I just kind of nerd out over it. So it's kind of a perfect fit.
Absolutely. So I'm curious, what were you doing before you got into nutrition?
I worked at a bank.
Oh my gosh, I did too.
Really?
Yeah, I did. I worked in banking before I went to business school, and then I ended up in corporate finance after banking. But yeah, I spent 3 years in banking.
That's so crazy. My undergrad degree is in business management. And so then I worked at a bank for like 3 years as well. And then that was a really stressful, horrible experience for me. And so I hopped ship from there.
Yeah, I definitely hopped out of the corporate finance realm just about as soon as I could after finishing my nutrition certification.
Yeah.
I mean, not only was it just not the career for me, but I was also just like so passionate about getting started and helping people. So definitely a very similar story to yours. I think a lot of us have that story of like we struggled ourselves and we found a better way with food, and now we want to share it because we're super passionate about it.
Right.
So you kind of alluded to this a little bit in what you just told us about your fertility journey, but is that kind of the motivating factor behind why you decided to focus your practice on fertility and pregnancy?
Yeah, that's definitely a big piece of it. Also, I just feel like there's not enough talk about this subject. And to me, when we're thinking about fertility, there's this transgenerational epigenetic inheritance that happens. We know that the health of a mom when she gets pregnant can impact the health of her future grandchildren through different epigenetic changes. So to me, that's just like, wow. By focusing on fertility, that's the ultimate in preventative medicine, right? I mean, you want to talk about preventative medicine, let's catch somebody generations before they're born. So it just seems to me like there's just not enough focus on that, and not enough talk around it. And then, when I went through my birth experience with my daughter, I had what some might consider, a pretty woo or a pretty crunchy birthing team and birthing plan. But even still, even with all of those types of practitioners on my team, there still wasn't a lot of focus on nutrition. And maybe that was just my experience. Maybe it's because they knew what I did. They're like, oh, she's got that. We don't need to mention it. I don't know, but I just found that a little odd. So I'm like, you know what? This is an area that really deserves a lot of attention and focus.
Yeah, I completely agree. I'm actually surprised in talking with other women about, even with exactly the sort of scenario that you're talking about, where you have a lot of like more natural and holistic type approaches for pregnancy and birth, nutrition still isn't really getting the attention that it should. And I think, some of it is just a lack of education around that. I feel like there's a lot of new research that's come out recently that a lot of people just aren't aware of. It's one of the reasons that I love Lily Nichols' work so much, because it's like so research based. It's so nice to like have a resource like that. When somebody says, what should I eat while I'm pregnant? Here, read this book. It's
Right.
very well researched and cited. A lot of programs are actually kind of taking that on as like part of their curriculum for teaching in like midwifery and other types of programs like that. So I think it's wonderful that the amount of focus on it is growing, but I completely agree that it needs more attention. And so I'm glad that we're chatting about it.
Yeah, me too.
So how did you learn about AIP, and what was it that motivated you to actually pursue the certified coach training?
Sure. Yeah. Well, I had been, I've been following several health blogs and different health publications for a long time. So I had definitely heard about autoimmunity and the AIP protocol kind of thrown around here and there. So I had looked into it a little bit and gotten familiar with it just from, reading. And then when I was working on my master's degree, I had an amazing autoimmunity instructor. Oh my gosh. She was just so great. And so she really piqued my interest in autoimmunity even more. My mom has an autoimmune disease, and, when we're thinking about autoimmunity, the reason I decided to pursue the AIP coach training, autoimmunity is so prevalent. And again, kind of like we were talking about with the fertility and the pregnancy, it needs more attention. It needs more of a voice. I mean, there's over 50 million Americans with autoimmunity. And honestly, I think that's probably underreported just because of how broad the symptoms can be. And so diagnosis might not happen when it should. And it's costing more than cancer. There's over 100 different autoimmune diseases. I mean, this is like a big topic. And so I wanted to learn everything I can and get the knowledge I needed to really help serve this population. And then I started making a lot of connections to how much it ties into fertility and just immune and hormone regulation in general. So that's where I started.
Yeah, autoimmunity is so much more prevalent than people realize. It's really funny to me. I have a lot of autoimmunity in my family. I have Hashimoto's myself. My dad was actually diagnosed with ankylosing spondylitis in his 30s. And when he was diagnosed with that, no one ever told him that it was an autoimmune disease. He
Yes.
actually didn't know that it was autoimmune until I started researching and like taking my nutrition training and learning more about autoimmunity. And then I was diagnosed myself. I don't think that he realized that even his sister, who has celiac disease, Addison's, and Hashimoto's, I don't think he realized that all of that was autoimmune either. So I think that's part of it, is like just the education piece for people. Like they may have a diagnosis and just not even realize that it's autoimmune, or kind of what the underlying pathology is there. And I think there are a lot more people suffering with inflammatory symptoms that are kind of pre-autoimmune, and they've never been tested for antibodies. And so they're just kind of managing pain or other inflammatory symptoms without really ever getting a diagnosis.
Exactly. Yeah. And once you have, autoantibodies, you can have autoantibodies, but not have an autoimmune disease. But that doesn't mean that you don't have autoimmunity, right? Like that's literally the definition. And so if somebody has a positive test for autoantibodies, but has no symptoms, that doesn't mean you should just wait and see, and wait to take action. That means that you are on a autoimmune trajectory. And so it can take, 4 to 12 years for the disease to come. So I just want people to take action now, not 12 years from now.
I think it's hard because the education in the conventional medical model just really isn't there, because there aren't really any treatments per se for positive antibodies without enough tissue damage to classify it as an autoimmune disease. And so people are like, doctors are telling patients, well, yeah, you've got positive autoantibodies, but you don't have enough symptoms of this particular condition for us to diagnose you, or enough tissue damage, or the antibody levels aren't high enough. And so they just say, well, we'll just kind of keep an eye on it and wait and see. And, the tools of diet and lifestyle have a lot that can be offered in that stage before it gets to like a full-blown autoimmune disease.
Totally.
Yeah, so let's talk about what AIP actually stands for, since we haven't done that yet. So what is it, and what's kind of the goal of the protocol? What do we use this for?
Sure. So AIP is an autoimmune paleo protocol, and it is a type of elimination diet. And the goal is that it just eliminates foods that can contribute to leaky gut. Research has come out that 100% of people that have an autoimmune disease have some sort of leaky gut or dysbiosis going on. And so it really focuses on eliminating foods that can contribute to leaky gut or dysbiosis, or foods that can inhibit different digestive enzymes, which would interfere with the digestive process in general. It eliminates inflammatory foods, or foods that can cause disruption in the endocrine system. And so the goal is just to provide a bunch of nutrient-dense foods that promote healing and immune regulation, and kind of eliminate anything that could slow down or hinder that process, and just give the immune system just kind of a break and a chance to heal and restart, so to speak.
Yeah, re-regulate itself a little bit.
Yes, re-regulate.
So there's a long list of foods that are eliminated on this protocol. A lot of people's eyes kind of go really wide when they first see what's eliminated. And of course, we have to focus on the fact that it's not forever. We don't eliminate these foods permanently. This is really just, like you said, to calm and rebalance the immune system and promote healing. So talk about the groups of foods that are taken out with AIP.
Sure. So it is based on like a paleo approach. So it does eliminate everything that is already eliminated on a paleo diet. So that would be like all your grains, which includes gluten, dairy, legumes, processed food, vegetable oils, sugar. And then the additional items that are excluded on AIP are also nightshades, eggs, nuts, seeds, alcohol. And so those foods can have compounds in them that can interfere with digestive enzymes, increase intestinal permeability. So all of those are cut out in the initial stages as well. And then, as you mentioned, this is not meant to be a forever protocol. So later on, there's reintroduction stages, and there's levels of reintroduction that people may be able to introduce some of these foods. For example, some people, we start with introducing egg yolks over egg whites, and there's kind of a tiered ladder that we follow to see what foods people can tolerate long term.
Yeah, I think one of the pushbacks that I get sometimes about AIP is that a lot of foods that are actually really nutrient dense and healthy are eliminated on this protocol. Like one good example of that would be nuts, seeds, and eggs, because all of those foods are really nutrient dense and can do some awesome things for fertility. And the thing that I tell people about that is that it's not that these foods aren't healthy. It's just that when a person's system is that compromised, in the case of severe gut dysbiosis, leaky gut, and autoimmune disease, when you have this like flaring immune system and this very compromised gut, those foods don't necessarily work for those people, even though they're nutrient dense. They still contain some things that wouldn't bother somebody who was in a healthy state, but they do bother somebody who's in that kind of flaring autoimmune state. And that's the justification for just taking them out temporarily. But the idea is always to make it back to the least restrictive, supportive diet that we can.
Exactly, yes.
So, food is one really important aspect of AIP. We've already talked about the elimination side of things, but food isn't the only thing that we talk about with AIP. So, what are some of the other pieces of a true AIP approach to healing?
This is such a good question because it is so much more than just what we eat. Like we mentioned, really the goal is to just give the immune system and just the body a chance to just kind of calm down and just rebalance and just take a break so that it can just focus on healing. And so there are lots of things besides food that can put us in a the opposite of calm state. And one of the big ones is environmental toxins. These can have really big impacts on the immune system and the endocrine system. So reducing your exposure to environmental toxins is a huge piece. We cannot eliminate our exposure to everything, but just bringing a lot more awareness and doing everything we can to reduce our exposure is huge. Also, sleep is huge. Being able to get more in line with a natural circadian rhythm can do so much for the body's natural ability to heal and regulating the endocrine and immune system. So that's a huge piece. Genetics are a big piece. I focus on this in my practice, and it's so important to just make a note that I don't ever want to run somebody's genetics and make them feel like they are doomed or destined to have one outcome over another. But it just gives us more information. And, there's a common saying that floats around the blogosphere that, genetics load the gun and the environment pulls the trigger. So there are things we can do to up or down regulate different genetic SNPs or mutations that somebody might have that might contribute to autoimmunity. And then also past childhood trauma, I think, is a really big one that's not talked about enough. If somebody has a past childhood trauma, their chances of developing an autoimmune condition or disease later in life goes way up. And so this is something important for people to think about and can be a little confusing. Like, what? Something that happened when I was 7 can affect me now? And it really can. And so going through different healing modalities to really lift that blueprint off of the body can really help with healing.
Absolutely. Yeah, I think that's really important to address, things that kind of imprint on us like that and can have a significant physiological impact on how our bodies are functioning. Yeah, I definitely think that that's not talked about enough. That's probably not talked about enough just in general in the context of fertility, not just with autoimmunity, but with fertility and pregnancy and various chronic diseases that aren't autoimmune in nature. I think there's definitely a huge component of past trauma and emotional issues going on there as well.
Yeah, absolutely. I agree. The ACE study is the study that kind of looked at this, and even an ACE score of 1, which just means one traumatic event, during childhood. And when I say traumatic event, I'm not talking about like getting in a car accident. I'm talking about anything like watching your parents fight, or having drugs in the family, or going through watching your parents get divorced, and then of course any sort of abuse. But just an ACE score of 1, just one traumatic incident, can have an effect on your chances of developing autoimmunity in the future. So it's a big deal, and worth looking into and digging deeper.
Yeah, definitely. I think a lot of people sort of minimize their pain. They don't think of some of those things like watching your parents fight or get divorced or something as a traumatic event. And part of that is because that's so common, so many people go through that. They don't think it's super, I guess unique, and that it's not worth looking into as a potential issue. But yeah, that's definitely not the case.
Yeah.
So let's talk a little bit more about how AIP can specifically support fertility and possibly pregnancy, depending on the situation. So, like, what symptoms or issues might cause you to recommend AIP during preconception?
Yeah, so autoimmunity can really interfere with super important hormones needed to become and stay pregnant. And so when we have an autoimmune condition and we're trying to conceive, if that autoimmune condition is really flaring, it just makes everything so much harder, because then we're dealing with hormones that are imbalanced, and a gut that needs some attention and some healing. And so the AIP protocol is really just so helpful to help balance those hormones, bring things to levels that are more optimal for fertility. Also, it's super nutrient dense, and you want to be thinking about your nutrient stores before you conceive. So many moms, get their positive pregnancy test, and then they're like, okay, now I'll think about what I should or shouldn't eat. Or even worse, they get their positive pregnancy test and then think, great, now I have an excuse. I can eat whatever I want, which is really not a recommended thought process. And so the AIP protocol can just really boost those nutrient reserves, improve overall gut health, which we know how many other systems in the body the gut has an impact on. And so all of this is really just to support a super healthy pregnancy. I do want to just throw out an extra thought, just like there's no one diet that is good for all people. I wish it was so easy as saying like, oh, you have any one of over these 100 AI conditions, here, do this protocol and everything will be great. I would love to be able to say that, but I just think it's important to remember that this is just a protocol. It's a really good nutrient dense protocol. It's a super good way. It's a super good starting point. But it may not be the magic bullet for everybody, and just having somebody that can help you work through some of those intricacies or customization. We're all just so bio-individual, and I just don't want somebody listening to this to think like, oh, great, I'm trying to get pregnant. I have Hashimoto's. I'll just do this protocol and then everything will be great. And there might just be more to the story than that. And having somebody dig deeper and help you figure that out I think is worthwhile.
Absolutely. There's a lot of troubleshooting, I think, that can go into AIP. There's a lot of different ways to customize it. There's a lot of different potential pitfalls with autoimmunity, and things that might be affecting people beyond just what the protocol says to do. And so I definitely, I've had this experience personally, trying AIP and seeing a little bit of improvement, but still struggling with issues that really required a lot more personalization and troubleshooting. So absolutely, I completely agree. I think it's important to work with someone not just for the troubleshooting and personalization aspects, but also just for the support aspect of it, because it can be difficult to go through. And if, you're not seeing the results that you want, that can be also really discouraging. Might cause you to give up a little too soon on it as well.
Yeah, or give up like right before your reintroduction stage. People think that once they get through it and they're ready for reintroduction, like that's it, all bets are off. But no, there's a very specific reintroduction template and protocol that we follow to make sure that we really have accurate data of what's working well in your body and what's not. So I've had that happen where people go through it and then they just eat everything on that very next day. I'm like, no, don't do that. So yeah, having that support is super key.
Yeah, so talk for just a second about reintroductions, because that's something I don't think we've ever covered on the podcast before. You really do need to do these one at a time, right? Like the point of reintroductions isn't just to say, okay, I did my protocol, now I can eat all the things. The point of an elimination diet is to figure out what's working for your body and what's not. And if you start eating a whole bunch of foods that you've eliminated and then you start feeling bad again, you really can't tell what food might be triggering those symptoms to return. So can you talk just a little bit about like what the procedure is around reintroducing? You don't have to get like super detailed, but just, how do we do it?
Yeah. So after you have gone through the initial protocol, then there is a reintroduction stage. And like I kind of mentioned earlier, there's just different levels of reintroduction. And so usually we start with foods that are least likely to cause issues. Like reintroducing gluten would not be one of those foods. Gluten tends to always cause problems, and most people are not able to reintroduce that, or maybe shouldn't reintroduce that. So, like we talked about earlier, introducing egg yolks before you introduce egg whites. The egg yolk has less of those compounds in it that can cause issues with the gut or with just the digestive system in general. And the egg yolk itself is just more nutrient dense in general. So we would reintroduce that first. So we would reintroduce the egg yolk, see how you do, see if there's any symptoms. This would be over a several day period. And then we see how that goes. And then we decide to introduce the next food. And I like to do foods one by one, just because I like having data, and I like being able to pinpoint exactly what's happening.
And I think that's really important too for the client that's going through the process, is to have that information for themselves and to do it in a way that allows them the information that they need to make the best decisions about the dietary approach that's going to work best for their body. So I like going slow and taking people through it really carefully as well, just because there are a lot of potential pitfalls. I think if somebody is going to have trouble with AIP, reintroductions is going to be definitely one of the places where they might stumble more than almost any other place. Like even just the elimination stage, people think that that's the hardest. It's actually keeping your head on straight during reintroductions that I think is the hardest.
Yeah, and people can get after they've gone through this whole protocol and now it's time for reintroductions, people can just get excited for it to be over. And really, I like to just tell people it's just the next phase. It's not that it's over and we're at the very end. We're just in the next phase, and the reintroductions can take a while to get through and have enough time to know how it's impacting your body. So I like to set that precedent and expectation and let people know what they can expect at the beginning.
Yeah, definitely. So let's talk a little bit about pregnancy. Before we actually started recording, we talked a little bit about this, but is AIP something that you would ever recommend that someone start during pregnancy?
This is a really good question. I I do not use the AIP protocol for my pregnant clients. And this is for several reasons. Number one, I like the AIP protocol so much because the point is to give us information, right, about the body. And a lot of how we measure and get that information is based on how somebody is feeling and the signs and symptoms that they are experiencing. And so when we're pregnant, our immune system is already a bit suppressed. So number one, a lot of people with autoimmune conditions feel amazing when they're pregnant because they're not creating as many autoantibodies, and they love being pregnant. They just feel so good. So that is not a good time to be trying to measure and collect data based on signs and symptoms when you have this outside influencing your immune system. And so it's just not a good time for measuring how somebody is feeling or their improvement, first of all. And then also, somebody can have a lot of food aversions when they're pregnant. And, you know, if they're having an aversion to meat and that's their main source of protein on the AIP protocol, well, that can be really tough. And because it's so restrictive, it can be stressful for somebody to go through, especially if they don't have the right support. And I will just share with you, when I was doing my master's degree, I did my capstone research paper on the impact maternal stress can have on the infant microbiome, which was so interesting, and a conversation like for a totally different day. But the takeaway is that any stress that the mother is feeling while she's pregnant, anything that we can reduce is really a good thing, not just for her health, but potentially for the health of the infant and the infant's developing microbiome. So I don't like to do anything that could be stressful with somebody who's pregnant. And then I do want to say that this does not mean that pregnancy is like a free-for-all, which I kind of alluded to earlier. Eating a particular way, eating very nutrient dense when you are pregnant is so important. It requires nutrients to build a healthy baby. It just does. And so creating a custom plan that feels manageable and nutrient dense and still free of any pro-inflammatory foods is still super important while you're pregnant. That being said, if somebody is doing AIP while they're pregnant, it's not an issue of like, oh, you're going to be depriving your baby by doing this protocol. That is not an issue. The AIP protocol is very, very nutrient dense, and it's customizable in a way that you can fulfill all of your nutrient needs, and then, you know, any additional supplements that you might be taking. But yeah, I don't want people to think they can't grow a healthy, happy baby while on the AIP protocol. I just don't recommend it, just for the reasons I mentioned. I don't recommend someone starting one once they become pregnant.
Yeah, I definitely see the value in doing that. I actually will use it during pregnancy, but I don't use it strictly during pregnancy. I basically will kind of share the information about the various foods and tell people, like, you know, here's a goal of like some of the foods that we can eliminate to help calm the immune system, especially if you're having symptoms or if you're concerned about your baby's health. Like, there's no danger to doing this, but also like if you're having food aversions or if you're super stressed out about it, customize it. You know, don't eliminate everything. I like to kind of provide the education and then leave it up to the client to understand how they're feeling and what their body needs. So I definitely don't use it strictly. It's more of like an educational type of thing to say like, hey, these are the foods that we might want to consider as being stimulating to the immune system, but you should eat based on how you're feeling and making sure that you're like getting enough food, because that's super important, especially during that like first trimester when you're totally right. There's a lot of food aversions, especially to meat and higher protein foods. People crave carbs during that time. And so what I tell people with autoimmunity during that first trimester, it's like, if you could at least keep the gluten, the dairy, and the refined sugar out, like I feel like you're
Yes.
doing pretty well.
Yes, I love that so much. Yeah, I take a very similar approach. I guess what I was meaning when I say that I don't recommend it, it's like exactly what you said. I don't recommend going through like, okay, we're going to do this strict protocol and this is the first phase
Yeah,
and then we're going to do these reintroductions, and it's, you know, like this very rigid, strict thing that it might be preconception. So yeah, I love that approach. I agree.
awesome. All right. So can you give us some examples or like maybe some stories of clients that you've used AIP successfully with in your practice for fertility?
Yeah, I actually recently had a client that was really struggling to become pregnant and then also struggling to stay pregnant, had several miscarriages. And so through our time working together, her and her partner were just getting ready to start down the IVF road and start more conventional medicine fertility treatments. And through our work together, she was able to conceive. And I just, having a story like that just really like breathes life into what I do, because that is the end goal, is to, you know, make a baby. But it's not just that, it's to make a baby, you know, in a body that's really healthy and ready and willing to grow and nurture that body, or grow that baby, I mean, you know.
Absolutely. Yeah, I think that that's really important to think about, is that it's really like pregnancy, yes, that's the goal, especially if you're struggling with infertility, but people don't want to just get pregnant. Like the ultimate goal is to bring home a healthy baby and to be in good shape yourself, to be able to care for and raise that baby. I think one thing that's important to note about autoimmunity that maybe a lot of women don't know is that the shift in the immune system that kind of makes your immune system a little more tolerant during pregnancy does shift back postpartum. And so, you know, if you haven't been taking care of yourself preconception or during pregnancy, that can set you up for an autoimmune flare postpartum. And, you know, that can affect your ability to breastfeed and, you know, just to be able to be present and have energy, depending on what your specific condition is. That could be really disruptive to that postpartum period. And so, you know, focusing on growing and nurturing your baby, but also nurturing your body during this time so that maybe you'll be in better shape postpartum and experience less symptoms of flare as the immune system switches back to kind of its normal mode for your body.
I'm so glad you brought that up. Yeah, a lot of my experience using AIP with my clientele really does come in the postpartum period. And I know that this is a, you know, podcast more around fertility and pregnancy, but even people who didn't have an autoimmune condition before they got pregnant can oftentimes develop one, just because of exactly what you just said. And this can be really tough for women, you know, like if they develop Hashimoto's and they, after they give birth, and let's say they're having symptoms of like, I'm tired, or I'm having mood swings, or my hair is falling out, or anything like that, and they go to their doctor and tell them that, well, their doctor might say, well, yes, welcome to motherhood. That's that's what it's like. And they might not get the attention that they're really needing, and digging deeper into really discovering that, oh, you have developed an autoimmune thyroid condition, you know, that needs much more attention and support.
Yeah, I think that highlights a bunch of other problems that we could, I'm sure, do entire podcast episodes about, which is kind of a very unfortunate trend in women's healthcare of discounting symptoms and attributing them to things that that really aren't the cause, kind of oversimplifying or discounting, not taking things seriously, and kind of just telling women to, for lack of a better term, to man up, you know?
Mhm.
And, oh, sorry, like you just had a baby. This is just going to be a really hard time, and you're just going to have to deal with these symptoms and live with it. And I think the other thing that it highlights is just what we talked about at the beginning, which is that autoimmunity can have a lot of these non-specific symptoms, especially in the beginning. And it can take many doctors, like dozens of doctors, and, 5-10 years to get an accurate diagnosis. And during that time, how much tissue damage is done.
Exactly, exactly. And if we're thinking about, yeah, I mean, I I could go into it much more in depth, but yes, I just absolutely agree. Just thinking about these women that are really suffering and needing support and needing somebody to reach out to is just, it makes me sad, but it also makes me happy that there seems to be a trend and more people, like practitioners that are focusing specifically on the postpartum population that can kind of step in and be like, all right, I believe you, I'm here for you, let's look into this, let's figure this out.
Absolutely. And a lot of women in that postpartum period are going to want to be thinking about having another baby. Some people experience this immune shift after their first, and they're not done having kids. And then how does being treated improperly and not getting the diagnosis and the support that you need, how does that then affect the next pregnancy? Because secondary infertility is a very real thing.
Absolutely. And if we think broad, this, if the mother's not getting the support she needs postpartum, it can impact milk supply, it can affect breastfeeding, that can impact infant health. Now we're talking about this, transgenerational effect that I was talking about earlier. So yes, it's an important topic.
For sure. So I'm curious whether or not AIP is something that you typically reserve for clients with a diagnosed autoimmune condition, or if you find that it can be helpful when people have more inflammatory type symptoms, but they haven't been specifically diagnosed. Do you have a an approach that you prefer in those situations?
Yeah, I mean, like we talked about earlier, we can be on an autoimmune path without having a diagnosed autoimmune disease. I don't need somebody to tell me that they've been diagnosed with an autoimmune condition to recommend AIP. I just kind of look at their symptoms and their past, their birth story, their childhood, things like that. If we can do some functional medicine testing, maybe around autoantibodies or even just some genetic testing. So I just every person is so different, and I just kind of piece together all of the puzzle pieces that I have and that I can, and then go from there. But no, I don't need a diagnosis to recommend the protocol.
Yeah, I completely agree. I think it's enough to see a lot of inflammatory symptoms in somebody and know that even if that person doesn't have a diagnosed autoimmune condition, they may be at risk of developing one in the future. And all of the conditions and symptoms that we have, I don't think that we currently recognize the full spectrum of autoimmune conditions in our medical system now. I feel like we're just going to keep adding them to the list as we discover more and more conditions that have an autoimmune component. So yeah, I think it's much more important to look at symptoms and the presentation and the history of the person to decide whether or not something like this is appropriate. Like I would never say, oh, you must be diagnosed with an autoimmune condition in order to try AIP. Definitely not.
Yeah, that feels a lot more of a conventional medicine approach to me.
Definitely.
Yeah.
Yeah, for sure. So, what are some resources that you can recommend for listeners who are interested in learning a little bit more about AIP? I'm so excited to see this community growing and the quality resources growing. So, what are some of your favorites for people to learn more?
Yeah. So Dr. Sarah Ballantyne, she's a pretty big name in the AIP world. She is very good at digging into the science behind things. And she has really built out a lot of resources for the AIP community. So I think she's a great person to look into. Also, Angie Alt and Mickey Trescott with Autoimmune Wellness. They are also have a ton of resources for people. Mickey has a couple cookbooks, so that's great. And there's a directory of AIP certified coaches that people can look at if they're looking for more personalized support for just not so much the AIP protocol specifically, but just some kind of overview, general information on just autoimmunity. I think Tom O'Brien and Keisha Ewers are really good resources. They both have books and websites, and they just really explain a lot of just more what is autoimmunity and what contributes to it and what can you do more so than the AIP specific protocol.
Yeah, I read Tom O'Brien's book, I think right after I finished my nutritional therapy training, when I was just like really kind of starting to see more symptoms like that myself. I really enjoyed his book and the explanation of really what's happening in your body and how to understand it better. I think that starts to help us, like when we really understand what's going on in your body when you're experiencing or diagnosed with an autoimmune condition. I think that's super important because it helps us start to make connections between how different systems are like intertwined, because we're just not educated that way about our bodies. Like we think of, oh, my immune system is like separate from all of my other body systems. It's like, no, it's definitely not. But I think with the way that we have medical specialties structured in conventional medicine, it doesn't encourage us to look at the full picture and how all of these different systems are intertwined, particularly when it pertains to fertility, because we think of the reproductive system as something that's like separate from the immune system. And I think that leaves a lot of women kind of falling through the cracks and not getting the support, the education, and the resources that they need to be successful.
Absolutely. And I loved, Tom has a really good way of just using analogies and just a good way of explaining things in a very non-scientific way that people can not only understand, but also remember. I remember I was watching him speak once and he was talking about how, I'm not going to remember it exactly, but it was something along the lines of like, imagine that Arnold Schwarzenegger is like in your body and it's his job to like go through and attack these certain cells. And he was talking about molecular mimicry and about how our bodies can get confused sometimes attacking foreign versus our own tissue. And so he's talking, imagine that Arnold Schwarzenegger is going through your body and, he's got his leather jacket on and he's got his sunglasses and he's got his machine gun and he's going through trying to attack, his target. But he's floating through and he's getting all jostled around and his sunglasses make it dark. And so he gets confused and starts shooting, your own thyroid tissue or whatever. And so just little things like that, I think people can really resonate with and really start to just remember, even though that's clearly not the scientific explanation of what's happening.
Right. Yeah. I think it's nice to have something that's not so sciencey, for people that either don't have a background in that or just really want to understand the basics of what's going on. I think it's wonderful that there are so many, kind of pioneers in this field that are sharing information in different ways. Like somebody might want to sit down and read the first couple chapters of the paleo approach where the science is super dense and they want to know what every single immune cell in their body does and how it's dysfunctional in autoimmune disease. But other people just kind of really need to know, like, what are the basics of what's happening in my body and why do I need to care about this?
Right.
So yeah, great resources. I love that. I will link to those in the show notes so that people can easily access the things that we talked about here and learn a little bit more. So as we're kind of wrapping up here, first, I would like to ask you kind of what is your what is your biggest piece of advice for any woman that's going through kind of an immune-based fertility situation right now?
My biggest piece of advice. When somebody is trying to get pregnant and they have other issues that they may be contending with, like immune issues that may be hindering their conception process, it can just be so stressful and so heartbreaking. And especially if you're a woman that's maybe watching your friends or your colleagues or your peers, having babies and starting their families, it can just start to get really lonely and kind of turn into a bit of a dark place. And so my biggest advice is to just really seek support, whether that's, a practitioner that focuses on this, or somebody that's removed from your situation, or just joining like a Facebook group that you can just vent to. I just really recommend reaching out to support, because infertility is so common, more common than we think, more common than what's recorded or reported. And it's not something, it can feel so isolating, but it's not something that is super unique. And so I just really recommend reaching out and getting support, and just knowing that you are not alone. And there are people out there ready to help you. There are people out there ready to listen to you, ready to support you. And yeah, I think that's a big piece.
I think that is fantastic advice. More than just do a protocol or, try this or try that. It's really, I think the support piece is key. And like you said, whether that's a practitioner or it's a supportive group of women, other women that are going through similar issues, I think we really need to start getting rid of the stigma and that isolation that comes along with infertility, and sharing our stories and finding support in other people is a really big piece of finally being able to do that, and having this be better understood by those that are going through it, as well as those that are watching friends and family go through it. So that's great advice.
Yeah.
So
Absolutely.
tell everybody about your practice and how they can connect with you.
Sure. My practice is called Thriving Vitality, and I practice mostly virtual. I focus on what I call pan-natal health, which is kind of a term that I came up with. And it just means that it's the entire time period from preconception to postpartum. It's just like that whole period. And I don't think there's a word that means that. So if there is, let me know. But in the meantime, I've come up with the term pan-natal. And so I focus on that whole time period. And I am trained in functional medicine. And so I take that functional medicine approach, which I know you've talked about before on the podcast, and I know that you do as well in your practice. So it's a very intensive, thorough intake process, and really getting to know you as an entire person, as an entire organism versus specific organ systems. And we go through, and then we focus on, diet and lifestyle, environmental toxins, genetics, past trauma, all those things that we talked about earlier, and just see what we can do to really optimize your health and have you regain your vitality and start thriving again, which is how I came up with the name for my business. So I can be found on my website at thrivingvitalityllc.com, or also on Facebook.
Awesome. Well, we will link to your website and social media here in the show notes. Brandy, thank you so much for joining us. Really appreciate you being here to discuss this important topic and share your knowledge and wisdom about how you're working with and helping your clients. So thank you very much.
It was really my pleasure. Thank you.